Hey guys, welcome back to my channel. If you're new here, my name is Dr. Maushmi Das and today I am here to continue my series on anatomy of larynx. In my first video on this, I have spoken about the extent of larynx, the different parts, the blood supply, lymphatic drainage and the mucosal lining of larynx. In my last video, I have spoken about the laryngeal cartilages, the ligaments, membranes and the joints. So today, I'm going to be speaking about the muscles of larynx. Now let's start our session today.
So our topic today are the muscles of larynx. Now you can divide muscles of larynx into two different groups, the extrinsic muscles and the intrinsic muscles. Now first we'll talk about the extrinsic muscles. Now what are these extrinsic muscles? Why are they called extrinsic? So these are the muscles which are attaching larynx to the neighboring structures and helps in maintaining position of larynx in the neck. Now these extrinsic muscles can be divided into further two types, the suprahyoid muscles, the muscles which are lying above the hyoid bone, and the infrahyoid muscles, the muscles which are lying below the hyoid bone. Now when you come to the functions of these extrinsic muscles, the first function is that the infrahyoid muscles, they are working in synergy with the elevators of larynx. Now what happens is the infrahyoid muscles, while they are relaxing, the other suprahyoid muscle, they contract and thus help in laryngeal elevation. Now second function is that under normal physiological functions, the descent of larynx is happening due to the elastic recoil of trachea and the lower respiratory tract, and therefore for this descent of larynx, only the relaxation of suprahyoid musculature is the only requirement. So we see that there are two functions. One is laryngeal elevation, which is happening while the suprahyoid muscles contract and the infrahyoid muscle relaxes. And secondly, the descent of larynx, which happens only because of the relaxation of the suprahyoid musculature. Now, what are these suprahyoid and the infrahyoid group of muscles? These muscles, first the infrahyoid group, they are all depressors of larynx. Now there are three infrahyoid group of muscles. They are Thyrohyoid, Sternothyroid and Sternohyoid, whereas suprahyoid group can further be divided into two. So suprahyoid group, as I already told you, they are the elevators of larynx. Now we can divide this group into primary elevators and secondary elevators. Now what do you mean by primary elevators? They are called primary because they are acting directly, as they are attached to the thyroid cartilage, which is a part of the laryngeal framework. And the secondary elevators, they are acting indirectly because they are attached to the hyoid bone, which is not a part of the laryngeal framework. So these suprahyoid group basically consists of Stylopharyngeus, Palatopharyngeus, Salpingopharyngeus, which are the primary elevators, and the Mylohyoid, Geniohyoid, Stylohyoid and the digastric, which are the secondary elevators of larynx. Now that we have spoken about the extrinsic muscles, we will move on to the intrinsic muscles and why they are called so. So, the intrinsic muscles are called intrinsic because they are attaching the laryngeal cartilages to each other. It is not connecting to other structures beyond the laryngeal framework. Hence, they are called the intrinsic muscles. Now, what are the functions of these intrinsic muscles? Number one, they function in a coordinated fashion to move the cartilages of the larynx, therefore helping in governing the laryngeal function. Secondly, they control the overall position and the shape of the vocal folds as well as elasticity and viscosity of each layer. And last of all, they act to move the arytenoid at the cricoarytenoid joint and therefore helps in opening and closing the glottis. When they rotate inwards and downwards, they close the glottis, and when they rotate upwards and outwards, they open the glottis. So these are the three functions of the intrinsic muscles of larynx. Now when you come to the different group of muscles of which are composing the intrinsic muscles, we can divide them on the basis of who they are acting on. So the first group are the muscles which are acting on the vocal cords. Now these can be further divided on the basis of what their function is on the vocal cord. So the first is the abductor of the vocal cord, which is the posterior cricoarytenoid. Now posterior cricoarytenoid is a very important muscle because it is the only abductor in the larynx. There are no other abductor. If it stops functioning, there will be trouble in abducting the vocal folds. Now next are the adductors of the vocal folds. They are the lateral cricoarytenoid, interarytenoid, which is also known as the transverse arytenoid. Next is the thyroarytenoid's external part. And lastly, there are some tensors of the vocal cord, which are two muscles, the cricothyroid muscle and the vocalis muscle. Now this vocalis muscle is actually an internal part of the thyroarytenoid muscle, which I was telling you earlier is the external part being an adductor of the vocal cord. Next, the second group of muscles here are the ones which are acting on the laryngeal inlet. Now these again can be divided on the basis of function, as in how they open and they close the laryngeal inlet. Now the opener of laryngeal inlet is the Thyroepiglotticus muscle, which is again a part of the thyroarytenoid muscle. And second are the closers of the laryngeal inlet, which are the interarytenoid, the oblique part of it, and the Aryepiglotticus, which is the posterior oblique part of interarytenoid muscle. So this is in a nutshell the different group of muscles, which are the extrinsic and intrinsic muscle. Why are they called so? What are their functions, and what are the different classification of the group of muscles within it? Now we will be discussing each muscle in detail. So first we will be discussing the intrinsic muscle. So as I was telling you, they can be classified on the basis of their function and the structure that they are working on. So first we will be talking about the ones which are helping in opening and closing the glottis. Now these four muscles are the ones which are helping in opening and closing the glottis. So first is the posterior cricoarytenoid. Now posterior cricoarytenoid, it takes origin from the lower and the medial surface of the back of the cricoid lamina. As you can see over here, this is the back of the cricoid lamina. This is where it takes origin from. Then it fans out like this and gets inserted into the back of the muscular process of the arytenoid. As you can see over here, this is the muscular process where it is getting attached. So this muscle, why is it important? It helps in opening the glottis. The upper horizontal fibers, they rotate the arytenoid and move the muscular processes towards each other, and therefore helping in separating the vocal processes and abducting the cords. Whereas the lateral vertical fibers, they draw the arytenoids down the sloping shoulders of the cricoid and helps in separating the arytenoids. Now as I was telling you, these muscles, they have some effect on the vocal fold as well. So what happens in case of posterior cricoarytenoid is that it abducts and elevates the tip of the vocal process. What happens because of this is that the vocal fold becomes elongated and thin, and the free edge of the vocal fold, it becomes rounded and passively stiffened. So this, as I was telling you, the posterior cricoarytenoid is the most important muscle because it is the only abductor of vocal fold. As you saw here, it is originating on the back of the cricoid lamina and fanning out to get inserted into the muscular process of the vocal of the arytenoid cartilage. The next muscle is the lateral cricoarytenoid. Now this muscle takes its origin from the superior border of the lateral part of the arch of the cricoid. As you can see over here, this is the origin of the lateral cricoarytenoid, and it gets attached in the same place as that of the posterior cricoarytenoid, that is the muscular process of the arytenoid, as you can see over here. Now this muscle helps in adduction and lowers the tip of the vocal fold, vocal process by rotating the arytenoids medially. Now, as I was telling you, they also have an effect on the vocal folds. What happens to them is that the vocal folds are adducted, lowered, elongated and thinned. In this case, the edge of the vocal fold becomes sharp and is passively stiffened. So, the difference between posterior cricoarytenoid and the lateral cricoarytenoid in case of its action on the vocal fold is that the vocal fold is abducted in case of posterior cricoarytenoid and it is adducted in case of lateral cricoarytenoid, and the free edge of the vocal fold is rounded in case of posterior cricoarytenoid and becomes sharp in case of lateral cricoarytenoid. Next, we move on to the next muscle, which is the transverse arytenoid muscle. Now, this transverse arytenoid muscle is one unpaired muscle. It takes origin from the posterior surface of the muscular process and the outer edge of the arytenoid. What happens, as you can see over here, this is the transverse arytenoid muscle, the one in purple color. This muscle, as you can see, it's taking its origin from one side of the arytenoid. It crosses over the midline and it attaches onto the same point on the other arytenoid, as you can see over here. So, it is one unpaired muscle. If you see in the second picture, you can appreciate it. This is the muscle, the transverse arytenoid muscle. It extends from one arytenoid to the other arytenoid. The function of this muscle is that it helps in adducting the vocal fold and controls the position of the vocal fold. This muscle does not have much effect on the vocal fold mechanical properties. And lastly is the oblique arytenoid muscle, which is a paired group of muscle, as you can see over here. This oblique arytenoid, as you can see, going like this obliquely from one side to the other side. It takes its origin again from the same place, which is the posterior aspect of the muscular process of the arytenoid, and it goes to the opposite direction, crossing the midline and gets attached to the apex of the arytenoid. This muscle as well helps in adduction of the vocal fold, but it has no significant effect on the mechanical properties of the vocal fold. So, these are the four muscles which are helping in opening and closing the glottis, which is basically the posterior cricoarytenoid, that is the only abductor we have in the larynx, and the other three are the adductors of the larynx, which are the lateral cricoarytenoid, transverse arytenoid, which is an only unpaired muscle, which is a very important point, and the oblique arytenoids. Next, we move on to the group of muscles which help in controlling the tension of the vocal folds. And as I was telling you before, there are two such muscles. They are the thyroarytenoid or the vocalis muscle, and secondly the cricothyroid muscle. Now, thyroarytenoid is a broad sheet of muscle which lies lateral to and above the free edge of the cricovocal ligament. This muscle, a part of this muscle is called the vocalis muscle, which is the tensor of vocal cord. The lower part of the muscle is thicker and forms a distinct bundle, which is called the vocalis muscle. So, when we are discussing about the origin, this vocalis muscle takes origin at the back of the thyroid prominence and the cricothyroid ligament. As you can see over here, this is the vocalis muscle. It is taking its origin at the back of the thyroid prominence and the cricothyroid ligament, and it gets inserted into the vocal process of the arytenoid and the anterolateral surface of the body of the arytenoid, right over here. So, this muscle over here is the vocalis muscle, which is a part of the thyroarytenoid muscle. Now, the effect of this muscle on the vocal fold is important. It lowers, shortens and thickens the vocal fold, causing the edge of the fold to become rounded. Now, in this case, the body of the fold is actually actively stiffened. You saw earlier that the posterior and the lateral cricoarytenoid muscle, they were passively stiffened. And many fibers are prolonged into the aryepiglottic fold, some continuing to the margin of the epiglottis as a thyroepiglottic muscle, which tends to widen the inlet, pulling the AE fold slightly apart. So, now we have seen this vocalis muscle already. Next we will head on to the cricothyroid muscle. Now the peculiarity about the cricothyroid muscle is that it is the only intrinsic muscle which lies outside the cartilaginous framework of the larynx. This is important. It is an outlier. Now this cricothyroid muscle, it takes its origin from the lateral surface of the anterior arch of the cricoid, and the fibers, they fan out and pass backwards in two groups. You can see over here, this is the cricothyroid muscle. And the lower oblique fibers, they pass backwards and laterally to the anterior border of the inferior cornu of the thyroid cartilage. The anterior straight fibers ascend to the posterior part of the lower border of the thyroid lamina. As you see over here, it takes its origin from the cricoid cartilage arch. Then it fans out and pass backwards in two groups, and ultimately they get attached to the anterior border of the inferior cornu of the thyroid cartilage, which is not visible over here right now, somewhere over here. The function of this cricothyroid muscle is that it tenses the vocal cord. What happens is that it rotates the cricoid cartilage about an horizontal axis which is passing through the cricothyroid joint. It lengthens the vocal fold by increasing the distance between the angle of the thyroid cartilage and the arytenoids. On contraction, the vocal folds are brought into a line between the anterior commissure and the posterior cricoarytenoid ligament. The level of the vocal folds is lowered and the entire fold is elongated and thinned. So you will see that both the Vocalis and the cricothyroid muscle, they are both helping in changing the tension of the vocal folds. What the cricothyroid is doing, it is lengthening the vocal fold, whereas what Vocalis is doing, it is shortening the vocal fold. So thus these two are the tensors of the vocal fold. Next we move on to the intrinsic muscles, which helps in altering the shape of the laryngeal inlet. First we will talk about Aryepiglotticus. Now, as I was telling you earlier, Aryepiglotticus is a continuation of the oblique arytenoid. It takes origin from the posterior aspect of the muscular process of the arytenoid. You will see over here, this is the aryepiglottic muscle. So this muscle, it takes its origin from the posterior aspect of muscular process of the arytenoid. They pass through the apex of the opposite arytenoid and insert into the AE folds. See, these are the AE folds. And the effect of this muscle is that it is a weak sphincter of the laryngeal inlet. And lastly is the Thyroepiglotticus muscle, which is a continuation of the thyroarytenoid muscle. This muscle takes origin from the back of the thyroid prominence and the cricothyroid ligament, and it passes again into the AE fold and helps in widening of the inlet, pulling the AE fold slightly apart. So, in the picture you can see this is the Thyroepiglotticus muscle, which is a part of the thyroarytenoid muscle. As you can see, this is a thyroarytenoid muscle and this part is a Thyroepiglotticus muscle. These are inserting into the AE fold same as that of the Aryepiglotticus muscle, and it helps in widening the inlet. Now all these intrinsic muscles that I was telling you about, all of them are supplied by the recurrent laryngeal nerve except for one muscle, which is the cricothyroid muscle. I was already telling you that it is the only outlier muscle over here, because it is the only intrinsic muscle that lies outside of the laryngeal framework. This cricothyroid muscle is having a different nerve supply, which is the external branch of the superior laryngeal nerve. So thus these are all the intrinsic muscles of the larynx. Next we come to the extrinsic muscles of larynx. As in the beginning I was telling you, extrinsic muscles can be divided into an infrahyoid and a suprahyoid group. First we will talk about the infrahyoid group of muscles, which are these three muscles: the thyrohyoid, sternothyroid and the sternohyoid muscle. So first we will see the thyrohyoid. The thyrohyoid, as you can see, this is the thyrohyoid muscle. It takes its origin from the oblique line of the thyroid lamina, as you see over here. Oblique line of the thyroid lamina over here. This is where it takes its origin, and it gets inserted into the inferior border and the greater cornu of the hyoid bone. So this muscle over here, this is the thyrohyoid muscle. This muscle, it helps in elevating the larynx on a fixed hyoid, or it depresses the hyoid on a fixed larynx. And this muscle is the one that is supplied by the hypoglossal nerve. Next comes the sternothyroid muscle. As you see, this is the sternothyroid muscle. This muscle takes its origin from the posterior surface of the manubrium and the edge of the first costal cartilage. This is the manubrium. So from the posterior surface of this manubrium and from the first costal cartilage, it takes its origin and it goes above and gets inserted into the thyroid lamina's oblique line, as over here. So this whole muscle over here is the sternothyroid muscle. This muscle helps in depressing the larynx and is supplied by the ansa cervicalis. And the third infrahyoid group of muscle includes the sternohyoid muscle. Now this sternohyoid muscle takes its origin from the clavicle, as you see over here, and the posterior surface of the manubrium over here, and it goes upwards and gets attached to the lower edge of the body of the hyoid. So this whole muscle is the sternohyoid muscle. Sternohyoid basically lies on top of thyrohyoid and sternothyroid, covering it. Now this sternohyoid muscle, it also depresses the larynx by lowering the hyoid, and it is supplied by the ansa cervicalis. So these three are the infrahyoid group of muscles, which are mainly the depressors of the larynx. These are also known as the strap muscles of the neck. Next we come on to the suprahyoid group of muscle. Now as I was telling you earlier, suprahyoid can be divided into primary elevators and secondary elevators. Now primary elevators are the ones which are acting directly because they are attached to the thyroid cartilage, and the secondary elevators are the one which are acting indirectly because they are attached to the hyoid bone. Now first we will be talking about the secondary elevators. Now there are 4 secondary elevators over here. They are the mylohyoid, geniohyoid, stylohyoid and the digastric muscle. Now first we will start with mylohyoid. Mylohyoid, it takes its origin from the mylohyoid line, which is lying on the inner aspect of the mandible right over here, and it gets inserted into the midline raphe and the body of the hyoid bone, right, as you can see over here. This is the body of the hyoid bone, and also this is the midline raphe. Function of this muscle is that it raises and pulls the hyoid anteriorly, and this muscle gets its innervation by the nerve to mylohyoid, which is an inferior alveolar branch of the third division of the trigeminal nerve. Next muscle is the amongst the suprahyoid group is the geniohyoid muscle. The geniohyoid muscle takes its origin in the genial tubercle of the mandible right over here. It lies on the inner aspect, and it goes and attaches itself to the upper border of the body of hyoid. So this muscle over here is the geniohyoid muscle. This muscle also helps in raising and pulling the hyoid forwards, and it is supplied by the C1 root of the hypoglossal nerve. The third muscle is the stylohyoid muscle, which takes its origin from the back of the styloid process, and it splits around the digastric tendon. Here, somewhere here lies the styloid process. That is where this muscle takes its origin from, and it goes downwards and it gets attached to the base of the greater cornu of the hyoid bone. This muscle is a retractor and elevator of the hyoid for swallowing. This is the muscle which is supplied by facial nerve. So, you see in this picture the stylohyoid muscle which took its origin from the styloid process and got attached to the cornu of the greater cornu of the hyoid bone right over here. The last muscle amongst the secondary elevators is the digastric muscle. Now, digastric muscle has an anterior belly and the posterior belly. Now, this muscle takes its origin from the digastric notch on the medial surface of the mastoid process, and it goes and attaches to the lower border of the mandible, and a fibrous sling helps in holding the tendon to the lesser cornu of the hyoid bone. As you see over here, this muscle is the anterior belly and this muscle over here is the posterior belly, and you can see over here there is a fibrous sling which gets attached to the hyoid bone. This is helping in maintaining a tension. Now, the anterior belly, it helps in pulling the hyoid anteriorly and upwards, and the posterior belly helps in pulling the hyoid posteriorly and upwards. And when it comes to supply of this, both the bellies have different muscle supply. The anterior belly is supplied by the nerve to mylohyoid, which is the same supply as the mylohyoid muscle, and the posterior belly is supplied by the facial nerve, which is the same as that of the stylohyoid muscle. So, these four are the muscles which are the secondary elevators of the larynx. Lastly, we come to the primary elevators of larynx, which are the Stylopharyngeus, Palatopharyngeus and the Salpingopharyngeus. This is something that I have already spoken about in my video on the muscles of pharynx. You can check my video out. I have spoken about the origin, the insertion, the nerve supply and the action of the muscles in great details over there. As you can see in this picture, this muscle right over here originating is the Salpingopharyngeus muscle, which takes its origin from the pharyngotympanic tube. This is the Palatopharyngeus muscle, which takes its origin from the heart palate and the palate and aponeurosis, and the Stylopharyngeus muscle, which takes its origin from the styloid process. So, thank you for watching my video. If my video has helped you, please share with your friends and please press on the like button, subscribe to my channel, and I'll be back with my next video next week.